Thank you. Yes, I'm Kaela Parnell. Last year I was the Bariatric Surgery Fellow at Dartmouth-Hitchcock Medical Center in Lebanon, New Hampshire. We want to thank SAGES for letting us present our study on the effects of using telemedicine for introductory bariatric surgery seminars during the COVID-19 pandemic. We have no conflicts of interest to disclose. So there are many requirements that patients must meet prior to getting bariatric surgery. Our institution, just like many others, also require that patients attend an introductory bariatric surgery seminar. The COVID-19 pandemic, however, forced us to transition these seminars into a virtual platform. While there is plenty of literature that shows that telemedicine is beneficial for bariatric surgery patients, including improved nutrition knowledge, improved weight loss, improved physical fitness, there's only a few studies out there that show the effects that telemedicine has for bariatric surgery patient volume. And the few patients that are out there, or the few studies that are out there, show conflicting results on what it does for volume. So we wanted to know if transitioning to virtual introductory seminars changed our volume. So the aim was to determine the effects that virtual introductory bariatric surgery seminars have on the seminar attendance rates and the surgery completion rates. The goals were to determine the change in the patient volume after transitioning to a virtual platform, as well as improve patient access to care. This study took place at Dartmouth-Hitchcock Medical Center, which is a large tertiary bariatric center of excellence in a rural setting. So in March 2020, when COVID-19 pandemic hit, we were forced to transition to a virtual intro seminars. All patients who are interested in bariatric surgery enrolled for these seminars on our website with the help of our enrollment coordinators. There were no in-person options available. Of note, the clinic visits remained in person. It was just the intro seminars that were transitioned to a virtual platform. We used the WebEx platform to conduct these virtual intros, and patients all agreed to participate. They could use the chat box and ask questions, but they were muted. And as we developed this platform, their identities were anonymous with anonymous usernames. We went through the process of bariatric surgery, the nutritional, psychiatric, and surgical aspects of the program, and we discussed how to enroll and insurance coverage details. We then performed a retrospective review before and after transitioning to the virtual platform, and we looked at seminar attendance rates and surgery completion rates. Were more or less people coming to these intro seminars and going through the program and undergoing surgery. The inclusion criteria were all the patients who registered. They were all 18 years of age or older, and we excluded patients in this comparison who attended both in-person and virtual seminars. This is what the seminar attendance rates looked like for the patients who went to an in-person seminar. 836 patients enrolled for the in-person seminar before the pandemic happened between April 2019 and February 2020, which is an 11-month period, and 66% of patients attended. This is what it looked like after we transitioned to a virtual platform. It looked very similar. 806 patients registered for the virtual introductory seminar after the pandemic struck between June 2020 and April 2021, which is also an 11th-month period, and 68% attended, so there was no difference. This table shows the patients that completed surgery in both groups. Elective cases were initially shut down during the pandemic, and the ORs started to reopen in June of 2020. So there was still a lot of variability in OR access, and we tried to limit the confounders by choosing a window that most closely resembled normal. The dates are different in this table compared to the pie charts before. On the right side of the table, you can see that we only looked at the first 5 months of the virtual period from June 2020 to October 2020. And during this time, 249 patients attended a virtual seminar. Out of these 249 patients, 49 went on to undergo surgery, which is 19%. We then, so we used the beginning of the virtual period, and we had to give people time to have surgery. That's why we only used 5 months. We then looked at 5 months in the year prior, June 2019 to October 2019, and 239 patients attended an in-person seminar, and 56 of those went on to get surgery, which is 23%. So there was no difference in these two groups. And of note, 17 patients were excluded who attended both an in-person and a virtual seminar. This is the breakdown of sleeves versus bypass for each group. And the in-person group is about half and half on which one's got a sleeve versus a bypass. And in the virtual group is about 75% sleeves. The relevance of this is unclear. It's likely due to the small sample size that we saw a difference in this. So in conclusion, transitioning to virtual introductory seminars did not affect our seminar attendance rates or our surgery completion rates. There were more bypasses in the virtual group, but again, it's probably from the small sample size that it showed that. Bottom line is there's many factors that go into why a patient completes the program and undergoes surgery. It's unclear if we didn't have OR limitations, if we would have had more surgical cases during that time. But patients overall, they like the virtual platform. It's in a rural setting, it's efficient, they don't have to drive in. So overall, we don't see a detriment in using this, but we plan to carry this out farther to see long-term trends. I'd like to thank our great bariatric surgery team at Dartmouth Hitchcock and all of the authors on this paper. Thank you so much.